Mesquite, hello Nevada, and the rest of the world, and welcome to Mesquite Weekly. So, joining us today is Congressman Stephen Horsford, and we would like to welcome the Congressman on behalf of Mesquite and the Virgin Valley and the Moapa Valley communities, because I think when you visit us, it's who you mean to visit is all of us, and we've had some invitation over in our other meeting. Congressman Horsford has served Congressional District 4 as our congressional representative and has been a frequent visitor to our community, showing a special attentiveness and connection to the rural area of CD4. Stephen Horsford is seeking a second term in 2018. Congressman, if I would like to make an introductory comment?
Well, first, thank you for having me. It's great to be back in Mesquite. I appreciate the opportunity to meet with constituents throughout the entire 4th Congressional District and Virgin Valley and the surrounding communities. It's great to be here talking with voters about the issues they care about, health care, prescription affordability, making sure that we're protecting Medicare and Social Security, which are programs that people have paid into and are entitled to receive in part of their enjoyment of their golden years of retirement. Mm-hmm. And I just really appreciate the opportunity to be here to talk with you today. So thank you.
Wonderful. Great to have you. One of the questions that's on everyone's concern as a Mesquite resident, there was a major catastrophe in Las Vegas, and the slaughter of 60 innocent music festival participants and severely wounded an additional 500 was caused by a Mesquite resident. And we were particularly taken aback because it was so close to our community, even though the event happened elsewhere. Mass shootings have continued unabated during 2018, and it has fallen on deaf ears among a substantial majority of our legislatures. What can we do to stop this insanity? How do we do this, and can we do this?
Well, first, as of today, we have had more deaths in schools due to mass shootings than we have military men and women who have died in active service this year. That, I think, should alarm all of us, that we have something very serious happening. It's not just this person who was deranged who caused the horrific event on 1 October. This is a problem, and it has been throughout our entire country, and it's time for action and no more talk. I lost my father to gun violence when I was a teenager, so I know the impact that gun violence can have on a family, on a community. And my position is very clear. I believe that we need to adopt a comprehensive set of gun safety reforms. First and foremost, background checks, particularly for those who have mental health issues or who have committed domestic violence. I believe we need to eliminate bump stocks like the one that was used. We need to restore the assault rifle ban because these weapons of war should not be in our communities or be used by individuals in our communities. We should close the gun show loophole where private parties can sell these types of guns without proper background checks. But we also need to address mental health care funding in this country and to address bullying in our schools. So I believe we need a comprehensive approach. It's not going to be one solution, but a number of things working together that will address the safety of all of our communities in this country.
This actually brings us to our next question, turning to healthcare. The communities of Mesquite and surrounding areas have access to limited healthcare because we are in a rural situation. We face restrictions due to increasing premium costs, insurance restrictions on transport to major urban areas, or coverage with providers across state lines. Rural healthcare is declining and costs are increasing. What can we do to provide healthcare and costs that are comparable to urban areas?
This is something that is very important and very unique to Mesquite because it is a rural community, it's a special community. However, they still try to lump it in with Clark County, and therefore we have insurance companies that try to sell plans and coverage out here, even though there's not an adequate network of doctors or specialists, and therefore that contributes to the issues around access, people having to drive to North Las Vegas or Las Vegas to see a doctor, or to wait long periods of time in order to receive that care. When I was in the Nevada State Senate, when I was a Senate Majority Leader, I actually took this issue on. And we worked with the insurance commissioner of the state to hold these insurance companies accountable that if they sell a plan here in Mesquite, then those services need to be provided in Mesquite. If not, it's illegal. And if there's anyone who's experiencing that, they need to contact their elected official so that it can be addressed. Now, as a member of Congress, this is a very important issue to me. I actually went through heart surgery a few years ago, and I now take a battery of medications to stay well. And one of the things that I've seen and that I've heard from constituents throughout this district is the rising cost of prescription medications, particularly for people who have diabetes, who have cancer, heart disease, kidney disease. And I have a prescription affordability plan where we will take on the pharmaceutical industry in order to force them to negotiate lower rates and to move brand name medications to generics quicker. I'm not taking a dime from the pharmaceutical industry, in part because this is going to be one of the central issues of my campaign. So we have a very dire issue here. The premiums were just announced for next year, and we're seeing something like 15% increases in premium cost for insurance, even under the Affordable Care Act. So we need a Congress that's going to work to address these issues. I understand the problems, and it's why I am here today to meet with constituents so that I know how I can fight for them once we're elected to this office.
May I ask you for a bit more clarity? The Affordable Care Act, as it exists today, is simply not sustainable. It's going to skyrocket premium costs because of recent events.
Under this administration, their failure to pay for shore up the cost for these exchanges, and the fact that we have in some communities only one provider offering insurance is one of the reasons the costs are escalating. I will fight to bring the funding that's necessary to shore up those health insurance exchanges and options so that we can drive down the cost. But the single highest driver of cost in healthcare is prescriptions. If we were able to reduce the cost of prescriptions, you would begin to see the overall cost of healthcare premiums go down, or at least not go up.
Okay. The state of Nevada has less and less funding available for education. Of an increasing student population, and our rural communities have been particularly hard hit. Our own city of Mesquite, the schools in the Virgin Valley area and the Moormappa Valley area have been hit with a 40% budget reduction because the Clark County School District is $68 million over budget. The question is, what can we do to assure that Nevada students and graduates from the Mesquite and surrounding rural areas are able to compete, and this is what the key of the question is, compete with access to universities and the job market in all of the United States. And I would like to hear something in regard to, is there a federal program to help these fundings? Because on a state-by-state basis, there's no equity. It's unequal. The school districts are unequal as far as how they treat their students or how they see their students as being, an important factor in maintaining a future life, not just for the state or the community, but for the entire U.S.
Yeah. To be clear, there is a federal role, but the largest portion of funding for schools, K-12, is a state responsibility based on the property and other taxes that are paid. I would support measures to leverage federal funding to augment state support of public schools, particularly schools like Virgin Valley High School, like you're saying, that are seeing huge cutbacks. $40 million.
$68 million was the budget.
Overall, the budget cut. What was the cut here of the era schools?
40%.
40%.
I can't quote you any exact numbers.
Yeah, well, that's a reading specialist. That may be the only science teacher. It may be, an entire grade being eliminated
or actually
and
worse,
increase class sizes.
Exactly, going from 40, somebody estimated to 90?
No. Yeah.
45 students per class.
For grades over fourth grade, because there is still a mandate in state law of first, second, and third graders having a class size reduction. But all of this is unconscionable.
Okay.
We need to be investing more in our schools at every level in order for our young people to have the skills and the education to compete in 21st century economy. The world that our young people are going into now is around technology, it's around engineering, math and science, it's around drones, technology and artificial intelligence and autonomous. That's their world, and it's going to be the jobs of the future. Over the last couple of years, I think you may know, my background is in workforce development and training. I ran the state's largest employment and training nonprofit, Nevada Partners, for over a decade. And even since I left Congress, I've continued to do that work. I helped bring Intel Corporation into Nevada to do a first of its kind training program, Future Skills, to train young people on how to make and operate these drones for commercial use. They're being used to fight fires. They're being used in agriculture. They're being used, obviously, in the delivery of products. Our young people need to know how to work in that space in the future. And yeah, they need to be prepared to go to college, but in some cases they may not even have to go to college to do some of these jobs, and that's why I'm a big proponent of career and technical education as well. So those are the things that I look to work on as federal representative with our state and local leaders to invest more in education with a special attention for communities like Virgin Valley that have unique needs. And like I said, I've been to the high school here. I know that there are a limited number of teachers and special teachers, specialists, and so if you eliminate one, that could very well be the only teacher who teaches that subject matter in the entire school.
Okay. There's one more question. You don't have to answer this one. I've heard a proposal being made in an organization that I attend to regularly with in Utah. It said, well, we need to put on a carbon tax on fossil fuel. And what was surprising is they said that Congressman Amadei is similarly minded on that, or at least he's supportive, or at least he's interested in the issue. Okay, if you'd like to provide your concerns or your thoughts on that, that's fine. If not,
I'm willing to look at any proposal,
right?
Particularly one that addresses the environmental needs of our country. Right now, we have an EPA administrator, Scott Pruitt, who is failing to do his duty to protect Americans and ensure that we have access to clean water, clean air, and those are the priorities that I believe that we need to be working on, which is to hold this administration accountable to those protections under current law, while we look at other proposals such as a carbon tax, which I would be open to considering based on the particulars of the measure.
We would like to thank Congressman Stephen Horsford for joining us in our show today, and especially for taking some of the precious time that I'm sure that you have, very little of.
So thank you so much. It's great to be here. I look forward to coming back many, many times.
The D Thai Bistro, a refreshing oasis in the desert. D Thai Bistro may be the only Thai restaurant in Mesquite, but it ranks among the finest in the state of Nevada, as well as southwestern Utah and northeastern Arizona. An extensive menu features many Asian delights. Traditional Thai dishes include all your favorites: Pad Thai, Pad See Ew, Pad Won Sen, Tom Yum soup, Tom Kha soup, and a variety of curries are prepared and served to your pleasure. The chefs and the staff at the Thai Bistro provide a pleasant, friendly atmosphere. The dishes are delightfully presented, fresh and superbly flavored, and delicious. My own personal favorite, spring roll, is not on the menu, but if you ask for the Rudy roll, the chef will be happy to oblige. Lunch and dinner are served daily starting at 11 a.m. and reopening after lunch at 4:30 p.m. for dinner. The bistro is closed on Sundays. Takeout orders are welcome. The D-Type Bistro has obtained a solid 5-star rating from the Mesquite Weekly, and customer reviews consistently provide glowing praise for this family-owned and managed house of Thai culinary delights.